and blessings, everyone. Welcome to Spotlight. This is a special edition of Spotlight. I'm Ed Juenka, and I am excited about this program tonight. And what I'd like you to do is call your friends, your neighbors, your family, and let them turn on their TV, switch the channel to JTV channel 55, or tune in to jtvlive.net on your computer, your laptop or desktop, whatever you have, because this is a very, very important program. I have with me Patrick Ladbury. He's a director of National Social Marketing Center in the United Kingdom, and that's a nonprofit organization that is dedicated to effectiveness of behavioral change program. Behavioral change program, changing the way you behave. Changing the way you behave. Now, this is a serious matter. Why do we need to change the way we behave? Why do we need someone to come and change the way we behave? Well, as you know, we're developing a national health insurance plan, and it's going to cost a lot of money to care for sick people. And what we have to do to help ourselves to reduce the cost of that national health insurance plan is to not get sick. That's the key. The key to the sustainability of the national health insurance scheme, as you heard me talk about so many times, is for us not to get sick. If we continue to get sick at the rate that we are getting sick, we will be bankrupt in a few years, as we're going to hear Patrick Ladbury explain tonight. So this is a very, very important event happening in the BVI. We have a person here that's going to be looking at how we can get the information that is going to encourage us to change our behavior so that we can maintain our wellness and save tons and tons of money in lost productivity, healthcare costs, pharmaceuticals, quality of life. I mean, the whole works. This is a really, really, really big deal, and I'm hoping that you will call your friends and have them tune in and pay attention tonight. It's going to be a great, great program. We're going to take a word from our sponsors, and when we come back, we're going to have Patrick Ladbury. We're going to be talking about changing the behavior of the people of BVI in order for us to maintain our wellness and cut back on the proliferation of chronic diseases. Keep it locked right at the Spotlight. We'll be right back after these words from our sponsors.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Roadtown, Tortola, BVI.
Calling all CCT Internet customers. Did you know if you have CCT Internet service including internet on your phone, you can connect to CCT's 4G Wi-Fi service free of charge? That means you can enjoy unlimited high-speed CCT Wi-Fi on any Wi-Fi device. Browse the web, check your mail, stay connected to any of CCT BVI's hotspots for free. Call CCT today and request your exclusive CCT Wi-Fi username and password and join the CCT Wi-Fi network. CCT, the home of unlimited.
It's fast, it's reliable, it's Bolo's full-color high-tech printery. For on-time production of your funeral booklets, graphic designs, CD covers, and complete wedding packages. Bolo's high-tech printery. Need your banners, brochures, posters, flyers, business cards, and stationery in a hurry? It's Bolo's high-tech printery. Whatever your printing or paper supply needs, no job is too big or too small. At Bolo's full-color high-tech printery, we don't just promise great quality, we put it on paper. Visit Bolo's full-color high-tech printery in Vanderpool's Plaza or call us at 494-3641.
Choosing a college education is one of the most important decisions that you will ever make. A college degree or certification opens doors to greater opportunities that will improve the quality of life for you and your family. The greater the investment made in education, the greater the returns. I am Charlita Millington, Regulator of Investments and Securities Business, and a proud graduate of the H. Lavity Stout Community College. A leader in higher education which aids in the improvement of life, a vibrant economy, and nation building. Any educational institution is best judged by its graduates, and the H. Laverty Stout Community College is committed to the development of the human resources of these Virgin Islands and the region. Now, because of HLSCC, I am making a difference.
Remember, at HLSCC, your tomorrow begins today.
Let's get this party started right now. Let's get this party rolling.
Yo, pick up your trash.
Let's get this party started right now. Let's get this party rolling right now.
There are designated dump sites in the territory. Would you throw the trash in the middle of your home? It is illegal to leave trash on top of your moving vehicle. The bag of garbage must be placed in the trunk. It is never to be left on the top. It only takes a few minutes to toss your garbage in the bin. When you don't take the time, litter and trash become an issue to everyone. Don't be careless. Make sure you toss it responsibly. The BVI is our home, so we ask each and every one of you to do your part and help us keep the BVI clean.
Please, throw your garbage in the waste bins. The BVI is our home and our future.
Drive and truck your bulky trash to the designated dump sites located at Sandbeal, Anegada, Pond Bay, Jos Van Dyke, North Sound, Virgin Gorda, and Hawkwood Pond, Tortola. Dare to care? Your BVI needs you.
Your car will love Virgin Island Motors' newly expanded, large, and more spacious, well-stocked automotive supply store. All your automotive parts and supplies under one roof. Get your cleaners, degreasers, refrigerants, solvents, thinners, tints, floor mats, wiper blades, seat covers, and much, much more. Everything you need to keep your car running smooth and looking new. Virgin Island Motors remain the home of the world-famous quality AC Delco parts. And when you and your loved ones are riding, make sure you're riding on Goodyear and Cooper tires. The sturdiest Duracell AGM marine batteries are now in stock at Virgin Island Motors. Virgin Island Motors, everything you need for a smooth ride.
Welcome back to Spotlight. I want to welcome you, Patrick Gladbury, to the BVI, and welcome to Spotlight.
Well, thank you, and thank you for putting on the extra show for the discussion.
Well, such an important person. I couldn't do otherwise. And I mean, you know, we've been talking for a while off the air, and certainly I think we've developed a real rapport. You know, it's and it's really great to talk to you. And it's good to have you in the BVI, particularly in the vein that you're in. Just tell us a little bit about your organization first of all. Yeah.
Well, we were set up 6 years ago by the Department of Health in England to look at their health programs and how we can add social marketing to those programs and improve the behavior change element of that program. So when you're looking at, as you mentioned, about healthy eating or physical activity or managing your condition, we looked at how social marketing can improve those programs. And then we set up 5 to 6 years of training, mentoring, developing programs, building evidence about how our approach works, and developing case studies, examples, so other people could follow. So that was set up for 6 years, and then at the end of the 6 years we set up as a not-for-profit, so that we continue our work for other programs and also in areas outside of health. So we look at environment and recycling. We saw one of the adverts about littering.
Yes.
We talked about a project, it was social marketing, and crime. So wherever there's a behavior element that needs influencing or change, then a social marketing approach could help.
Okay, and it's the National Social Marketing Centre of the UK. That's the name of the organization.
Yeah. But we've had, although we were set up by the Department of Health, we've worked internationally. So we're debating about whether we change from national to international social marketing centre. But we've worked, across the world.
So you go around trying to change behavior wherever you go.
Pretty much, yeah, and that can be the public's behavior, that can be health professionals or professionals' behavior who are running programs, who their interaction with people may need to be changed, and also policymakers. You can look at how you can influence their behavior to change the policies or programs that they're developing.
So for example, if you could go into a hospital and change the culture of behavior and performance in the hospital.
Yeah, one of the programs we worked on was for MRSA, infections in hospital due to hand washing, and we did a day studying the hospital ward, and the nurses and doctors were good, but they went, every time they walked into the ward, they went to press the hand wash, to wash their hand, but the bottle was covered in paper. So they never knew if it was empty or full. So something simple as that, as just taking the paper away so people could see if it was empty, then meant that it could be changed regularly. There was also there was a lady who went around giving books to people. She never washed her hands. The curtains were filthy, so they needed washing in terms of infection. So studying the actual behavior and where it's happening gives you real insight into how you can change things. So it wasn't just the doctors and nurses' behavior that needed changing. There was a whole range of other things that needed it changing. The design and the environment, which helps influence behavior.
And that's we're gonna come to that.
Yeah.
We're gonna come to that later. That's interesting. So you're going to develop a plan, a conceptualized social marketing plan for the BVI.
Yeah, I think it was 18 months ago, the government approved a strategy for managing the non-communicable diseases within the BVI, and so my role is to look at how we can implement that, and how we can measure the changes involved, and how we can develop an overall strategy. And what we're looking at is coming up with one program that looks at improving the health of the BVI, rather than just looking at alcohol, or we're looking at smoking or physical activity. We're looking at an overall wellness program, putting it together, so making that it's everybody's business. Health is everybody's business, not just the Ministry of Health or the health professionals, the doctors. It's everybody's business.
Now you must have seen the statistics that was gathered, I think in 2009, that speaks to our level of wellness, if you will. How does that strike you? I mean, you've seen those statistics.
Yeah, I've seen those statistics, and it's. I mean, they're high. They're high compared to what they are in the UK and in other, particularly European countries. I'm not sure about the statistics in the US. I haven't done much work over there, but they're high, which means that, as you mentioned in your introduction, the cost of health to BVI is going to go higher and higher and higher. And their conditions, the diseases, diabetes, heart condition, blood pressure, they're diseases that can be prevented if people make small behavior change in improving the health that they live and what they do.
And of course, with the National Health Insurance Scheme, and the figure I like to quote all the time, almost 50% of the population on one chronic disease or the other, with that statistic and the National Health Insurance Plan, it seems to me that like we're on the way to bankruptcy.
And yeah, unless the prevention work starts now, and one of the things we're looking at is the costs that are going to rise over the next years. The BVI, and saying to the government, people, look, this is how much it's going to cost. We have to do something now, and we have to change the behaviours now. Otherwise, it won't be sustainable, and the budget will have to go from certain other areas of spend from the government. So it's a pressing need to start now, and it's a long-term thing. These behaviours don't change overnight. You can't switch them on and off. The culture's changed in the BVI over the last 40 years in terms of what people eat and the physical activity they do. It's going to take a long time, 10, 15 years, to try and halt this rise in obesity and blood pressure and other diabetes, and then start to see an improvement.
Now you talked just now about looking at figures. Have you had a chance to make a projection based on what is costing us now based on the data that we have? Have you done anything with those figures yet?
Not yet. That's one of the things I'm doing over the next couple of days as well, working with the information team to see if we can get those figures about what it costs.
What the projected cost over time?
So I want to do a cost so that we have a cost from 2009 when we did the health survey of the risks that people have in terms of to their health, and then do it now, 2012, and so we can see that trajectory going and see how much it's going to cost if we don't do anything in 5, 10, 15 years' time. So, and then once you've made that economic argument to the government, to business who are working in the BVI, you can then say, right, we need to spend some money on whether it's changing some infrastructure, whether it's in community health, whichever. We look at where we're going to think we can improve, be most effective at influencing behaviors.
How is that done? How is behavior influenced from a social marketing perspective? How does that work?
The first thing you need to know is why people behave the way they do. Why are people not taking physical activity? Why are they not eating fruit and veg? Why are they perhaps drinking too much? So you need to understand it from the people's point of view, from that person's point of view. I may have a very different reason to you, and you may have a very different reason to a 16-year-old girl, who may have a very different reason to an 80-year-old man. So you need to understand your population and why they behave the way they do, and then what we try and do is we try and make it fun, easy, and popular for people to change their behavior. So you make it so that it's a benefit. People see a benefit to changing. If they don't see a benefit, why would they change? We try and make it easier. So we take away the barriers away from people in terms of how they're going to change their behavior. So things like access to fruit and veg. Can you make it easier that there's more access to fruit and veg and that's affordable? And then popular. So people don't feel like they're only doing it on their own. I'm the only one who's getting up at 5 to go for a walk. My neighbours are coming with me, or I'm doing it with a work colleague who we can go into work together. So you're making it that other people are doing it. You're changing the culture, you're changing the social norm about people doing that particular behavior. So that's kind of a mindset we try and follow, make it fun and easy and popular.
Well, I was just getting ready to ask you, when you talk about the culture of the behavior pattern coming out of culture, you would have to have a study to understand the culture of the people in the Virgin Islands from a historical perspective, won't you? How do you do that? Is that necessary? Is that important?
Well, I think we know enough about, and it's the same all over the world, as to why people these risks and diseases are growing and increasing, and the cost of healthcare is increasing because people are taking less physical activity. They're more sedentary. They're sitting at home, playing on their phone or watching TV. They're sitting during the work all day. They're not being physically active during work, and the diet has changed. You know, in terms of rather than growing your own fruit and veg, you're actually buying processed foods in, you're eating more fast food and takeaways, and you're eating out more, and maybe portion sizes have changed. So I think we know the reasons why that's happening. It's then saying, okay, from the BVI's point of view, what will influence BVI to change? And that may be different to what it is in the UK, to what it is in the US.
Because you're asking me to give up my barbecue chicken, my stewed chicken, my curry goat, and my rice and peas and macaroni and cheese and scalloped potatoes. I mean,
But we're not. And I think that's one of the myths about the changing the behaviour, is that you have to do everything. So here I am eating rice and beans kind of 5 times a week. I'm not asking you to give that up. I'm saying cut it down to 3 times a week, and perhaps have a slightly smaller portion size. The way you change a culture and the way you change behavior is small steps at a time, steps that people think that they can achieve, rather than if you say, right, you only eat 1 fruit and veg a day today, you've got to eat 5 fruit and veg tomorrow a day, every day. It's not going to happen because people are going to find that too difficult. How about if you eat 2 fruit and veg for next week? Great, okay, right, now do that 2 fruit and veg for a month. Brilliant. Let's move up to 3 fruit and veg. And so it's small steps you take, and everyone can take small steps to improve their health. And that's what we're trying to do with this movement, this kind of health is everybody's business.
What are the tools you're going to use? I mean, it seems to me you have to reach the people where they are, and how do you do that?
Yeah. Social marketing is a combination of marketing skills and techniques used in commercial marketing, like selling a can of Coke, and psychology and understanding behavior, which is a social science, which is where the name comes from, social marketing. And in marketing, they talk about the 4 Ps: product, price, place, and promotion. And often in public sector, we just go with promotion. We just tell people that they need to change their behavior, they need to do this and that, but we don't consider the other 3 Ps. And so with a can of Coke, if a can of Coke was twice the size, people wouldn't buy it, it's too big. If it was $6, it's too expensive, so the price would be wrong. If you could only buy it in a garage and not in supermarkets, they wouldn't sell it. So you need to get the price, the product, and the place right before you can do any promotion, before you can start to tell people. And the promotion is about the benefits you get from a Coke. It's not saying, I'm a can of Coke, drink me. It's about work, rest, and play. It's about kind of the image behind Coke. And so it's the benefits you get from Coke. And that's the tools we use in social marketing. What's your product that you can develop to help people change their behavior? So cycle lanes, parks, fresh fruit market. What's the price people pay? And that can be financial, money, or it can be psychological in terms of, I have to change my habit. My habit is getting home from work and sitting on the sofa. I'm asking you to change that habit and go for a walk when you get home from work. That's difficult. The place where you do that behavior, is it at work, is it at home, where, and then your promotion. So that's the same techniques but used for a different purpose and in a slightly different way.
So you need a mass media campaign, you need infrastructure, and accessibility.
Yeah. So you need a combination of things. You can't just you can't just go with a mass media campaign. People know this information. In the UK, and I don't know if it's the same in the BVI, but people know they should eat 5 fruit and veg a day. They know they shouldn't drink so much. They know they should exercise more, but they don't. And so why don't they? And that's your key, your research to understanding why don't they do it and what you can do to influence that behavior and make it achievable.
And one of the reasons in the BVI, for example, may be that we don't have access to easy exercise facilities.
That may be, and I've been here a couple of days, so I'm not sure. I mean, from the discussions I've had, that sounds very, very true. And just having a little walk around, Road Town, it's not conducive. It's not easy to walk around. So, but there's an example in Google, their head office in the States. Google have it's free canteen for the staff, and within 2 weeks, people put on 10 pounds. And so they've looked at it and gone, they've changed the way they've set up their canteen, so that when people, they discovered that when people walk into the canteen, they fill their plate with the first thing that's there, which used to be breads and kind of heavy calorie foods. They've now put the salads there. And then they've moved the desserts to the back of the canteen, and they've cut the portion sizes. So these little things you can do to kind of change the way you behave. So portion sizes is a classic. If you've got a big plate, you fill it. You've got a smaller plate with kind of more filling foods, you're not going to eat as much. And same with glasses. In the UK, liver disease is increasing because, particularly around middle-aged women who are divorced, because they're going out and drinking, and they're drinking the same amount as they did when they were teenagers. But they're not, because the glass sizes are twice the size now. So they're thinking they're having 3 glasses of wine, but they're not, they're having 6. Simple changes that can help you move your behavior towards having a healthier lifestyle.
We're going to take a break.
Okay, sorry, I'm talking too much.
No. You're talking good. I mean, it's great, but we got the break signal.
Sure.
Yeah, so we're going to take a break for a word from our sponsors. We're going to come back. I want to open up the telephone lines. You could text or you can call if you're intrigued by any of the discussion and you want to make a comment or you want to ask a question. It's a very important discussion. It's a very important event in the history of the BVI. I don't know if you're seeing the same significance and importance that I'm seeing, but when you're talking about changing human behavior towards maintaining wellness, certainly that's got to be significant. So if you want to make a comment, you want to call or text, The phone line is going to be open when you come back. We're going to take a word from our sponsors, and we'll be right back with more Spotlight.
Spotlight is brought to you by Bolo's High-Tech Printery, Virgin Island Motors, and Clarence Thomas Limited.
Did you know there's a drive-through lumberyard in the BVI? That's right, the only drive-through lumberyard in the territory. What does that mean? Well, for one thing, your lumber and plywood stayed nice, dry, and straight. No more curves. But not only that, there are experts on hand to help you with any and everything lumber. And there's also a pro store where you can get everything else to complement your purchases. Blocks, cement, molding, steel, windows, doors, galvalume, fencing, fasteners, tools, and that's just to name a few. Where is this place, you ask? Well, that's at CTL Lumberyard and Pro Store, of course. Visit us in Port Russell at the Old Sims location and see for yourself. Good lumber at the best prices. No, you can't beat that. Telephone us at 284-494-2359 and ask for our lumberyard. CTL Lumberyard and Pro Store, the best products at the lowest prices, period.
Are you a U.S. citizen or a resident alien living in the BVI? Do you meet the requirements to file a U.S. income tax return with the Internal Revenue Service along with any applicable foreign bank, financial accounts, and statements of specified foreign financial assets? If you answered yes to the previous questions, you need M.A. Clark, CPA, LLC, to assist you in complying with filing your requirements as well as small business account services. Call us today for a free consultation. 284-494-0401 or contact us on the web. We look forward to working with you.
Serving the community for over 25 years, Tortola Concrete Limited is the leading producer of concrete products in the BVI with grades of 3,000 to 5,000 PSI. Tortola Concrete ready mix quality unmatched in the industry, and we can mix to your specifications. Our aggregates are clean through our unique washing process for our smooth clean mix, and our special chilling process makes our concrete crack resistant. Tortola Concrete Limited is the concrete company for all your quality concrete products. Gravel, road base, face stone, boulders, armor rock, coarse sand, terrace, and the cleanest, strongest, crack-resistant, ready-mix concrete. Tortola Concrete batch plant serve you Monday to Saturday, 7 a.m. until the last load. Our knowledgeable, effective staff gives you free estimate and delivers on time to any location. Contact Tortola Concrete at 494-3259, Monday to Friday, 8 a.m. to 4:30 p.m. Conveniently located in Parkwood Pond near the BVI electricity plant. At Tortola Concrete Limited, the strength is in the mix.
Life is like a mountain you must climb. Life is like a treasure you must find. A baby learning how to talk. With just one step begins to walk. One step at a time will lead you to paradise. Your dreams are there to find. One step to paradise.
Welcome back to Spotlight. I'm Ed Juenko. I'm here with Patrick Ladbury. He's from the National Social Marketing Center in the UK, the director of the National Social Marketing Center in the UK. And he's here in the BVI to develop a social marketing program to change our behavior towards maintaining our wellness, which is a very, very important endeavor and difficult, I might add. The numbers are going to pop up on your screen. You can text or you can call. We'll be happy to hear from you, hear your comment, what you think. If you have a friend, call them and let them know that the Spotlight has a special edition on tonight, and a very important person is here talking to us about the government's plan, the Ministry of Health and Social Development's plan to have a social marketing program to help us change our behavior to maintain our wellness. You need to get in on the discussion. So now we're developing this program, and it's going to call for a lot of infrastructure. First, what we're looking at in terms of costs. How costly is this endeavor going to be?
Sadly, I can't give you that figure. Again, we're putting it in place. So we're doing the planning now. So what we're going to have to do is go to funders to say, this is how much we're predicting. So over the next couple of weeks, I'm working with Ms. George to put those figures together.
And that's understandable. But as far as time is concerned, what's your projection for a country our size, with a population of approximately 30,000 people, similar culture to the UK, similar culture to the United States, same types of food, same types of behavior, same types of activities. In terms of monitoring change and seeing results, you have an estimate of how that would run?
It goes back to your previous question as to how much money it's going to cost and how much. I mean, I guess I can say this as an outside individual who doesn't work for the government, but how much support we're going to get from government in terms of that infrastructure that's possibly needed. In terms of, we talked about two simple things of the accessibility and affordability of fruit and vegetables, which is one of the biggest barriers to people eating the fruit and veg, and also the places to be physically active, the parks, the pavements, places to walk, to run, to take your children to play. That's kind of two of the biggest barriers that, from our past experience of working in this area, are. And so, depending on how quickly those can be developed and put in place, depends on how quickly you can start to change people's behavior on a larger scale. There's things that people can do right now in terms of changing their behavior, which will have an impact on the health, but you can have much more of an impact with those infrastructure changes.
But I mean, where would we begin? We would need to begin somewhere. We're not going to have the infrastructure
straight away.
Overnight.
No. So what we're putting together is a program. So with an overall theme and logo to say this is, whether it's health is everybody's business or whether it's another kind of logo or strap line, and then we're saying, right, these are the behaviors we need to change. And this is how simple. These are the simple behaviours we're asking people. We're helping people to change, and whether it's on portion size, whether it's reducing the amount of fast food you eat during the day or at night, whether it's about taking 10 minutes out of the day to have a walk around your workplace or somewhere else, whether it's doing something with your colleagues. Simple behaviours. So these are the ones that can change. Now, people may come back to us and say, it's hard to do that because of X, Y, and Z, or this or that. So then we can say, okay, you're telling us this, we're working with you, we can try and do these things to help you with your behavior change. And whether that means a big infrastructure project or a small infrastructure project, whether it means it just needs somebody to organize a walking tour once a week. They could be community-based, they could be nationally based. We need to find out. We're talking to people about what will help them change that behavior. But you can't just rely on the government to say, we're going to do this. People have to take their responsibility for themselves to manage their own health, protect their health, and to stop themselves from getting conditions.
So how are you going to persuade people to take responsibility for themselves that haven't been doing so for the last
10,
50 years?
That's where research comes in. That's where talking to people, understanding. And the key to social marketing is, as well as what are the barriers, is what benefit people get from changing their behavior. Why would I stop eating fast food? You know, it's simple, it's cheaper, it's convenient. That means I don't have to cook when I get home, which is another 20 minutes, half an hour. I know my kids like it. So that's the competition you're facing in terms of...
you're tired when you get home.
Yeah, there's a lot of competition.
You get home late.
And so understanding what the competition you face, and that's the same in commercial marketing. You know, you talk about competing radio stations or TV stations. You have competition, and the same with social marketing. The behavior you're looking for has a competing behavior of what I do now and why you do that. And so again, you've got to offer something better than what you're doing now. So what's the benefit people get from changing that behavior? And that's what you need to talk, and that's what you need to understand, is what people get.
So, well, if we start where we are, for example, you could say that Well, we have a big track. We have a nice new track. I think it's maybe 4 or 5 years old. I don't even think it's that old.
What, a running track?
A running track.
Okay.
Yeah. So we could have it open up every day for up until perhaps 10 in the evening.
Yep.
It's a lighter track, which would provide an opportunity for persons to come down to the track and jog around in groups.
Yep.
That would be a use of the infrastructure for behavioral change.
Yeah, exactly.
We have a multi-purpose sport complex with volleyball, basketball. You could play badminton. You could play table tennis. You know, all that sort of stuff.
And that's exactly what we're talking about. But also, you need to understand, you know, that you have a group of a population, 30,000, different age ranges, and say you've got middle-aged men, 35 to 50. And there's, well, I don't know the figures, but there may be, say, like 5,000 of those. Some of them may be really interested in health, and they want to look after their health, and they keep themselves fit and healthy, and they go running around the track. Brilliant. There's some who go, I want to do some more, but I don't know how. You can help them. They may not want to go running around the track because they're intimidated by the fit guys who run around, so they're like, I don't want to go there. So you may go, we've got 9 till 10, we've got the fit guys going around the track, 10 till 11, we've got these guys going on the track, 11 till 12, that kind of thing. You need, because people don't feel intimidated. I was talking to somebody about community gyms in BVI, and some of them are locked. Yes. When people go, and so they're locked after work, so they're not accessed. You know, again, is that possible to open those up? Is this possible to have somebody there to train people on the equipment? People don't want to, you know, if you haven't done any exercise for 5, 6, 7 years, you don't want to go to a gym where, as it was described, a meathead's there, kind of a big, muscly guy pumping, you know, weights that big when you can, starting off with that. Again, you feel intimidated, you feel like exercise isn't for me. We did a program in, again, stop me if I'm chatting too much.
Go ahead.
We did a program in the north of England with, again, middle-aged men who socialized in the bars and the pubs. And again, they were overweight, they're at risk of diabetes, heart conditions, all kinds of things. And we said, but we need to do something. And they were like, weight loss is for women. It's not for us. We see all these Slimming World, Weight Watchers. We don't want to do that. So what we did, we said, okay guys, let's do a program up at the Hull City Football Club, their local football club where they went to support the team. We'll do it there. You get to talk to some of the coaches, you get a benefit. You get to train or do some of the things that the footballers are doing, and you get to do it with men like yourself, rather than kind of it's women only. So we said, it's for people like you. We can help you do this. The benefit is that you go into Hull City Football Club, you're socializing, and you're starting to learn more about managing your weight, but doing it in a fun environment with other people.
Well,
so that's an example.
Yeah, and now that I'm talking to you, it doesn't seem like initially that it's going to cost all that much, a whole lot of money all at once. Because if we took all the basketball teams, all the football teams, all the volleyball teams, and have them encourage people to come and work out with them, not necessarily play the volleyball with them, but do their warm-up exercises, then you would have a bunch of people who have real trainers training those other persons, and they all participating in exercise and fitness.
Yeah, and so there's a lot of community things you can do as well.
You can do, yeah.
And again, it's looking at the different groups you've got in your population, what will motivate them, what will help them change their behavior. And again, and then looking at the different behaviors. Some you can change with community involvement, some will need the infrastructure, and the fruit and vegetables accessibility seems a big issue and needs a lot of kind of different involvement with that. But we did another one in, again, south of England, called Active Mobs, where we said, right, you can decide what you want to do in terms of being active. And so there were some mums who dropped the kids off at school and organised a mob, a group, to go for a walk for half an hour after dropping the kids off school rather than going straight home. There was another group who said, we haven't played basketball for 10 years. We'll do that after work. So a group of guys, they could organize their own active mobs to get active, to do it with people like themselves, and then improve their physical activity.
Yeah. And also serves as a community bonding mechanism.
Absolutely, yeah. And so you start to, it can help with getting to know your neighbors and sort of starting to socialize with your neighbors as well as work colleagues or whichever. So
the whole culture starts to change.
Yeah, and also we're looking at work programs, work wellness programs as well, in terms of how employers can help employees become and monitor and manage their health. And so can they make behavior changes in work in terms of what they eat, or taking, I mean, again, crazy in the UK, and it doesn't seem to be in BVI. In the UK, you can get 10 minutes every 3 or 4 hours to go outside for a cigarette.
Yes.
You know, you get a cigarette break. If you did, can I take 10 minutes to do some exercise? No way, you'd be left out.
Well,
so you're rewarding bad behavior, the negative behavior is damaging health, but you won't reward good behavior, good health, which is...
I was going to bring that up, because a lot of bosses don't even want you to leave your desk to go to lunch.
Mm-hmm. Yep.
You know, and many times you need that break just for your own mind, for your peace of mind.
Yep.
And if you that'll be the challenge, how you're going to get the employers to go along. Are they going to feel like they are losing productivity? What is the benefit to the employer to have fit and healthy persons in their workplace?
And it's the same when you work with any partners, when you're putting together a program. The partners or the stakeholders have to have a benefit for being involved in the program. Otherwise you're saying, help us. You're like, why? What would I get out of it? What benefits are? So you need to understand the benefits your partners get. And so with employers, again, you're saying, here's your sickness rate. We're going to help you reduce that sickness rate by X, Y, and Z, increasing your productivity. Whether there's research out there which says if people take 15-minute breaks every 3 hours, it's good for their kind of mental health, their productivity, in terms of concentration, that kind of thing. And also in terms of sitting in front of a screen for 8 hours, 9 hours a day, it damages your eyesight if you can only do that. And the health and safety recommendations are that you take a break every, I think it's 90 minutes for your eyesight. So there's benefits there, but it's talking about the benefits other people get in terms of helping you with your program.
Yeah. And I don't think the business community realizes that when somebody is sick, they pay triple, because they lose the productivity. Mm-hmm. They have to pay for the sick day, and they have to pay for the health care. And now they might not pay for the health care directly, but they pay it in their taxes.
Yeah.
So you're paying triple for a sick person.
And then it's that's why we're talking about it's everybody's business, because it's not just the ministry. It's not, in some ways, it's not just the public. We've got to change behavior. It's business as well. It's community groups. It's NGOs. If we can get a whole kind of people working towards these kind of changing these behaviors, the other key to it is monitoring it. Is measuring.
I was just about to ask you how you're gonna measure the success of the program.
Mm-hmm. And I mean, the overall, what we're trying to do is reduce the risk factors to people getting sick and getting diabetes and heart conditions and blood pressure. So that's the overall measurement. We have the statistics from 2009, which say 45%. So we want to see in 5-6 years' time a reduction on that figure. But to get to that figure, there needs to be certain behavior changes that happen. And so what we intend to do is measure those behavior changes. So how many more people are eating fruit and veg a day? And so can we measure that figure in terms of sales from the supermarket, from people reporting that they're eating more, from workplace canteens, so you can see the different types of measurements. In terms of physical activity, again, people reporting whether they've got pedometers and they're measuring how far they walk and report it back in, whether it's people signing up for the active mob or getting trained by the basketball coach. So again, it's scientific. You need to be measuring it, and also you need to be saying that bit's not working. That bit, where we're putting some money and resources isn't working particularly well. We need to take that money away, but that bit's working really well. Let's put some more money input into that bit. So it's key to kind of a long-term program is that monitoring and showing that you're having an impact. And the funders will want to see that.
You're responsible for getting funding for the program as well, aren't you?
Yes, I'm working on that. So putting together a funding proposal.
So when you say a funding proposal, are we looking to get international help? Are there avenues and resources internationally that we can draw from to help with infrastructure, for example? Because I suspect what we're talking about right now is looking at the environment, using what we already have to begin the program.
Yeah.
But then you might want bike lanes, you might want tree-lined sidewalks, you might want more exercise facilities, more walking trails. You know, those would be major developments, and those would be costly.
Yeah. So I've been here 2 days. So in terms of who's going to fund it, how much it's going to cost, we're just at the start of the planning. But what I'm looking to do is say, okay, here's where we can start. We can start doing things with relatively low cost, that everybody can get involved and everybody can feel ownership of this health, and that we need to improve the health of the BVI, and it's everybody's business. So that's what we're going to start off with. Obviously, in terms of funding proposals, they take time to get the funding back in and the support. So we're looking at the 10-year program here, even longer maybe, but things we can do straight away, and then some in the medium term, some in the long term. So that's how we're looking at it. And
is some of that funding going to come from UK sources, for example, or American sources?
I think I've got a tenner. I've got $10 I can chip in, so I can. I don't know if that'll help at all, but.
I mean, is that something that what I'm really asking you, if that's something that you are charged with as part of your conceptualization?
No, I'm charged with putting the program together and putting the budget together, saying this is how much it's going to cost.
Okay.
Certainly in terms of where that money is going to come from.
That's the agent, a government responsibility.
I mean, if I can help, that'd be great. And if there's money from the Department of Health in England or UK that I can source and access, more than happy to help. But there's only so much I can do in a week.
Now we keep talking about fruits and vegetables and so on, and reducing sizes. One of the challenges we have with our nutrition as well is food preparation, because a lot of times we cook the vegetables to death.
Okay.
And so
you boil all the nutrients out of it and microwave it all.
So all you have is bulk and no nutrients. And so you still have the same challenge, because the nutrients is what provide the immune enhancement, right? The immune system enhancement. So is that going to be part of the program? Because it seems to me that you're going to have, along with all those other things we talked about, simultaneously there's got to be this persuasion, this constant talking to and showing and persuading on
and supporting
and supporting in the mass media, on the television, in the radio, in the newspapers, online. People are going to have to be seeing this thing, and the information is going to have to be easily accessible and available, and the techniques are going to have to be put in a bite size where they can feel that they can do it.
Yeah. And
is that part?
Yeah, absolutely. And I mean, I haven't looked at all the behaviours that are involved, and also what people are and aren't doing at the moment. Do we know that people aren't cooking at home anymore? Most people, it's anecdotal. Most people are saying it's likely that we're all eating, or people on the BVI are eating out more than they're cooking at home. Okay, which part of the population is doing that? Is it 25 to 40 year olds? Is it the 18 to 25? Okay, which group is it? Then okay, if they're eating out all the time, why is that? Is it because it's cheaper and they can't be bothered? Is it because they don't have the skills? Is it a bit of both? Right, now we can start to understand. Now we can start to kind of really understand it and help people. And it's not just about the mass media, it's about that support you can offer. And also people saying, wow, that meal was great. That tasted much better than it did from down the road where I bought it from the burger van or whatever it is.
And you're figuring that the market would drive, once people start, once the ideas and the behavior change start taking hold, then our food suppliers would have to change their behavior. How is that going to work? Are we going to try to get the food suppliers to change And I mean grocery stores as well as restaurants. Are we going to try to get them to change their behavior first, or have their behavior change?
Supply or demand? Supply or demand?
Yeah, market driven. Yes.
Yeah. Well, again, we've worked with supermarkets where people talk about frozen food, and so the fruit and veg, the fresh fruit and veg is too expensive, so they buy the frozen food. Right. So let's move. So we've worked with a couple of supermarkets where we've made the fruit and veg easier to buy, and in terms of price-wise, so then people can buy it and take it home, and then you've got the behavior change of cooking it and using it and not boiling it to death. So there's certain things you can do with the supermarkets, but again, the supermarkets won't do that if it's going to hit their profits.
Right.
So you need to see, okay, right, well, they need to see benefit for this as well, and whether it's known as the healthy supermarket or whatever, or part of a government program, they need to see that benefit for it as well. But it's a complicated thing. It's really complicated, this issue.
It's a big deal.
It's a big deal, and
it's a big deal.
Governments all over the world are having the same issue, and I don't think anybody has got it spot on exactly in doing all the behaviors and changing everything. It's just little bits at a time.
You got to take another break.
Okay.
I'll take a break for a word from sponsors. I want to hear from you. You can text me or you can call me on the phone and let us know what you're thinking about what we've been discussing right after these words from our sponsors.
Spotlight is brought to you by Tortola Concrete Limited and CCT Global Communications.
We have more than 30,000 products to improve your home. We have low prices that are guaranteed. We have helpful people to assist you. You can order Corian or granite countertops, windows and doors, and floors. For the best products at the lowest prices, visit CTL, the one-stop building supply store that will save you time and money. The best, and always have been.
Are you a U.S. citizen or a resident alien living in the BVI? Do you meet the requirements to file a U.S. income tax return with the Internal Revenue Service along with any applicable foreign bank, financial accounts, and statements of specified foreign financial assets? If you answered yes to the previous questions, you need M.A. Clark, CPA, LLC, to assist you in complying with filing your requirements as well as small business account services. Call us today for a free consultation. 284-494-0401 or contact us on the web. We look forward to working with you.
The BVI boasts some of the most beautiful beaches found anywhere in the world. It's our clear blue waters and pearly white sands that make it an ideal location for snorkeling, scuba diving, swimming, and exploring. Many locals enjoy spending time with their family and friends, and our visitors marvel at our shores. Yet, too often, more and more beachgoers are becoming careless. They're leaving their garbage on our sands and shores. Dumping trash and neglecting our environment eventually pollutes our lands and seas. The British Virgin Islands is known for its beautiful beaches. If we continue to litter our shores and waters, we'll only destruct our environment and tourism product.
Our beaches are our pride and joy. If we don't pick up behind ourselves, trash and litter will ruin our oceans and sea. Help us keep it clean.
Do you dive for litter? Do you even care? We didn't think so. Dare to care. Your BVI needs you.
Choosing a college education is one of the most important decisions that you will ever make. A college degree or certification opens doors to greater opportunities that will improve the quality of life for you and your family. The greater the investment made in education, the greater the returns. I am Charlita Millington, Regulator of Investments and Securities Business, and a proud graduate of the H. Lavity Stout Community College. A leader in higher education which aids in the improvement of life, a vibrant economy, and nation building. Any educational institution is best judged by its graduates. And the H. Lavity Stout Community College is committed to the development of the human resources of these Virgin Islands and the region. Now, because of HLSCC, I am making a difference.
Remember, at HLSCC, your tomorrow begins today.
Welcome back to Spotlight. I'm Edwinka, and I'm here. We're having a awesome conversation, fantastic discussion with Patrick Ladbury, Director of Social Marketing Center of the UK, and it's really some interesting stuff that's going to be taking place in the BVI in the next several years. This is a long-term plan.
Yep.
So, and we're talking 10, 15 years before we begin to see some real success, or you think we will see some success in a shorter term?
I think we can see success in some of the changes in behaviour, and so we can see that. In the UK, we worked on a similar program called Change for Life, and they set the target of reducing the increase in obesity in over 6 years. So they started it and then said they don't want obesity to increase anymore. They want to flatten it, and then they go down. And again, part of what I'm doing is looking at the figures and projecting and saying, okay, what's the realistic targets for the BMI and the obesity rates and the overweight rates and the diabetes, in terms of saying, can we get it down straight away, or over 2 years, 3 years, or do we look at plateauing it over before we can start to bring it down? So that's kind of what we're looking at, that projection wise. But I think you can have short-term kind of successes, but also there's medium term, and as you say, these things don't change overnight. It's got to be a 10-year, 15-year thing. The issues didn't rise overnight. They took 30 odd years to come into the BVI and be established, so it's going to take a similar time.
It's going to take a time. Are you going to? At what point are you going to begin? Are you going to begin with any specific age groups? How is that going? How is it work?
Again, I'm putting the program together, and it's got to be agreed by powers that be. But what my suggestion is that you can't do everybody straight away. You can't focus on everybody because you don't have the resources. You need to focus down. And also, what we're looking to do is, what do people think about their health at the moment? Are they interested? Are they worried about it? And so let's look at what people think about their health, and then say, okay, right, you're worried about your health. We can help you manage your health better by doing X, Y, and Z. So that's the approach I'm suggesting and we're looking at. But we're saying, let's look at the 25 to 44-year-old age range first of all, and also the 6 to 11, the kind of the primary school or the younger age range. A couple of reasons why. One, you install good behaviours early on. They're likely to continue through kind of later childhood and early years. And also the 25 to 44-year-old are parents, the 6 to 11-year-olds are most likely to be, so they can work together. With the 25 to 44-year-olds as well, in terms of if they start to change behaviours now, it's less likely they're going to get the diabetes, the heart conditions, or the high blood pressure as they get older in life, so they can start to make changes now as well. So it's a combination of both the childhood and the kind of the middle-aged parents coming together and looking at those changing those behaviours. As we move on over the years, we can then start to kind of focus down on other age range. It's not saying we're not going to help other people and sort of support them if they want to change their behaviour, but we really need to understand that age range, what it motivates them, what the barriers are, and then we can start to develop our interventions and our support programs.
Okay. And when you talk about 6 to 11-year-olds, you talk about primary school kids. Can we expect, for example, things like banning certain foods in school? I mean, because in California, that was something. There was an argument about that. That was something that they did in the high school. They banned soda fountain machines. Soda machines. I mean, are we looking at that type of well, not rigidity, but that control to say we are not going to have this type of food in our schools anymore, or don't sell this to children. That kind of stuff.
It's a tactic you can use, certainly, and different governments have different opinions and different appetites for how much control they want to use. Some are like, it's all free choice and we just let people choose whatever they want to do, it's out of our hands. Others are like, we need to direct people into the correct choices. Other governments are like, control, no, you can't do this and you can't do that. In the UK, they brought in the smoking ban as a control mechanism. You can't smoke in public places, and that's had an impact on reducing the smoking rates in
And
the UK.
we've done that here as well.
Okay, so it's kind of, that's a control mechanism that's happened in the UK. They're talking about a minimum price of alcohol units. So in terms of selling cheap wine or beer, there's going to be a minimum price, which drives kind of, again, the thinking is it'll stop people buying as much alcohol. So yes, it can be. Whether it happens in schools, again, I don't know enough about whether that's a school's kind of jurisdiction or it's a government's jurisdiction. But you need to
that's a people's decision. That would be a political decision.
Mm-hmm. Yeah, if it's a political or is it a school's jurisdiction as to what the children eat in their individual schools. So, but certainly again in the UK they brought in national standards for food served in schools, and it's got to meet those kind of nutritional standards so they're getting a good meal and eating well. The issue is, and again you need to look at the research, but if you ban something, it may make people want to eat it more. And so you're banning serving kind of soda or giving sodas in schools, so the kids go outside of the school and buy it from the local shop or hut or whatever it is. So yeah, you need to be aware that if you do one particular thing, you need to be aware of the consequences that may happen.
So go ahead.
Go on.
So you think the best approach would be to educate and give choice? At least one a good approach, because if as you said, one of the things we tend to do as human beings is go for the forbidden.
Mm-hmm. Mm-hmm. Yeah. So I think there's education. There's limited choice, so you can limit the amount of choice you get. And again, within the canteen example I gave you in Google, they're not banning anything. They're not stopping people from having whatever food choosing, but they're just shaping the way people choose. And so the fruit and veg and the salads at the front. The calorific kind of sweets and desserts are at the back. So, you can shape the way people choose as well. And there's a whole range of method of study and research called behavioral economics, which is exactly that: is how do you influence people's choice? And there's a famous book called Nudge, which has become very popular with the US and UK government about how you nudge people to change their behaviour rather than forcing them to do it. It's just making those small little nudges that help people choose it. So reducing your plate size, for example. So I can't give you an answer as to whether you should ban foods, whether you should do that. That's the debate we're going to have, and whether you try different things in different schools, and saying that's having more of an impact whether you ban it in one school. Again, there's a whole range of issues about doing that, but we need to be looking at how do we influence people's choice and how do we make that meal better. Again, I'm sorry,
no, go ahead.
In London there was a policy in one London area where they banned fast food places from opening within a mile of a school. So they did that, so the kids couldn't walk out and go and choose stuff. So then they did that, and then the burger vans or the chicken vans came in, drove in and parked outside the school gates to sell kind of bad, higher calorific food. So what the policy did, the local government did, was then worked with the burger vans and said, you're going to come in here, you need to make a bit of money, it's a hard time, this is your business, let's shape what you're selling. So let's make it more healthy. Let's change the way you cook the chicken or the burgers, and you offer salads and other things. And the children, they want a bit of freedom. They want to escape from the school. They want to feel a bit rebellious that we're not eating what the school did. So they've got that choice as well. So it wasn't a case. Again, it's about understanding your competition and working perhaps with it.
And you provide healthy choices.
Yeah.
If you want a limited choice in one area, you produce a choice in another.
In other words, people have got the choice.
Yeah.
But again, it's redirecting that choice. And again, in some of the things, whether it's possible or not, but a lot of the fast food restaurants and takeaways, can you work with them to make their food healthier? Yes. Can they reduce the fat? Can they reduce the sugar in and the salt and do that? And again, we've worked on a project with Indian curry houses in England about doing just that.
Now, we've noticed that the healthy foods have become more expensive, and the junk food have become cheaper.
Yeah.
Are we liable to see? One of the decisions perhaps that will be made is to have government have a relationship with food supply, with supermarkets, to perhaps change the pricing structure of food. Is that an option that we might have to look at?
It's certainly, because I think, from the couple of days I've been here, price is an issue for buying healthy foods. And I went around a supermarket today, and yeah, it's way more expensive than kind of the prepackaged food that you've got already. So that is an issue. Now, the reasons why that is, whether it's availability, whether it's subsidized food coming from overseas, I don't know what those reasons are, but it's certainly something that the government has to look at to say, if you want people to eat healthier, you can't put out the price market. You know, if you're earning the minimum wage or a little bit, and you've got a certain budget to shop each week, you've got to kind of make it affordable. Now, there may be that there are affordable meals that you can cook with fruit and veg, with pasta, that is cheap and can feed 2 days. So there's an education bit and a skills bit in terms of how you cook. But it's certainly something that people have come back saying it's too expensive. The accessibility isn't there.
Is that something that you're going to be showing as well, preparation of food and how you cook and perhaps using a small amount of money to feed a greater amount of persons? Are those things part of the program?
Yeah, that's part of it. Again, I can't say yes because the program hasn't been agreed, so it's certainly something we'd be looking at, saying if people's cooking skills aren't great and they don't know how to cook a meal and don't know how to put together a meal for $4 when actually buying a ready meal is $12. You know, there you go, we're saving you money, we're giving you a meal that will fill you up, fill your family up. You know, if that's possible and if that's doable, then that's certainly, and then again, you're showing the benefit to a family, saying if you cook healthy, you get a benefit of the cost saving as well as eating nutritionally and healthily.
The other challenge that we have, and another consideration that we look at here is growing local foods, and the feeling that's developing that local foods are better than imported foods, because of course we don't use the insecticides, we don't use the pesticides, we don't use the hormones, and so you have a healthier, a better quality product. Now that will require some subsidy, because farming around the world requires subsidy because of the nature of the industry. Those are recommendations that you might be liable to make to the government as well. Those
in terms of subsidies.
Well, the whole development of agriculture in the territory, as it relates to behavior change, to the behavior change program that you may be proposing.
I think we talked about earlier about infrastructure changes and how you make fresh fruit and veg affordable and accessible to people is the challenge. I don't have the answers. I can make suggestions, but there's people working in the Ministry of Agriculture who know this area far better than I do in terms of what the challenges are and what the issues are. But it's something that needs to change. Well, it needs to be changed. And if that's one of the things that will help change affordability and accessibility of fruit and veg, then yeah, it certainly needs to be looked at in terms of subsidies for farming and or people farming themselves, having little kind of cottage gardens or home gardens and growing various things themselves. So there's behavior change. The other thing that's quite complicated in this area, we've talked about a lot of behaviors and a lot of things that need changing, and sometimes it can just feel overwhelming. People are like, they're asking me to learn how to cook, to take exercise, to stop buying this, to change the way I shop. Lots of different behaviors, and it's like, it's too much, I'm not going to do anything. Again, it's being clear about in small steps.
You got to be careful not to be too overwhelming.
Yeah, you got to begin somewhere, and let's begin somewhere. And okay, I mean, often we look at what's the behavior and what's the impact, and which is the most impactful behavior on the problem that we have. And so that may well be, we need to get people walking and physical activity. So that may be the first thing we start to talk to people about, or it may be that it's cooking. It's an issue. But
I'm just trying to get a sense on how deep you're planning to go with the whole concept of behavior change and all the infrastructure changes and the social marketing and all that.
The non-communicable disease strategy that was agreed 11 months ago by the government touches on a number of these issues. And so I'm not making kind of new recommendations or suggestions. They're already there and being talked about and discussed.
You're just going to help to bring them into reality.
Actually putting them into implementation, and kind of our role is, okay, let's look at the population and how we can get people to change the behavior. The infrastructure is being discussed, and how much is being discussed and how close it is to being implemented, I don't know. I've been here 2 days and stuff, but it's certainly kind of being discussed and looked at by the government. My role is looking more towards the public.
Okay, so you're here for about 5-6 days?
Yep.
Okay. What are you going to leave here when you go back? What you leaving us with?
I'm leaving you a video of our discussion. That's great. So that's it. That's it.
So they could get all the information out.
Yeah, exactly. So I can then just go away. Yeah. I could just. I'm going to leave there's a couple of things. I'm going to leave a structured plan that we'd like to kind of put towards kind of being recommended and implemented. There's some research and data collection that needs to happen. There's also a research plan that I want to put together in terms of how we understand people's behaviours a bit more, and also a bit about understanding more about social marketing and how you influence and change people's behaviours. There's a bit of capacity building and skill development that I'm talking to various people about, how you can start to train people up so they start to use it, that they can get mentored and they can start to develop the skills in social marketing and influencing behaviour, so that it's not requiring me or anybody else to come back time and time again with new programs or whatever, that people can start to develop it themselves.
Well, I'm glad you raised that issue. I was planning to end the discussion,
okay.
But no. You opened an avenue that I haven't thought of. Capacity building. What skill sets are we going to need for developing and implementation?
Well, I think this a social marketer needs a number of different hats on it. It's a good project manager. It needs to have research skills. There's great communication skills. There's kind of service development and service delivery in terms of whether it's health or environment or whatever. And there's evaluation and monitoring. So, those are just some of the, and stakeholder management, stakeholder engagement. So there's a number of skills there. Now, finding one person with all those skills, I don't have all those skills. I know what's needed.
So we will need a team.
So putting a team together with, and either you have somebody who knows what makes up a social marketing program, and then you have somebody who's got good research skills, somebody with the communication skills, and there's certainly the skills there within the people I've met so far, but it's pulling them together, and there may be little bits that need kind of adding on and developing to kind of improve the way the social marketing program runs, and that new social marketing programs are developed.
And you would also, part of your remit is also to provide some of that training.
Yeah, and our organisation is really set up to build capacity and skills in other people. That's what we thrive on, is saying we don't want to do it for you, we want to get you to do it, and then we can then help you continue to do it as you go on, rather than us coming back again and again whichever organisation, because that's not sustainable for governments, for organisations, bringing in consultants or various people to do it. You've got to have the skills within your own set to be able to do this.
Patrick Gladberry, I can't thank you enough for...
Pleasure. No, thank you. I really enjoyed it. It was a great discussion.
For the conversation. Yes, I had a fantastic time. I don't know if there's anything else I neglected to ask you that you want to add. We covered quite a bit.
No, I think we've talked about it. I haven't been able to be specific about what's happening and the costs and some of the questions you've asked, because it's just in the planning stage.
Yes.
But I think the message out to people is we've got to take responsibility ourselves, and we can start making changes now. Before anything is kind of launched or developed, we can start making those small changes now.
Before we go bankrupt, because of our health, right?
Yeah.
Because of our sickness.
Yeah.
So. Yes. Thanks for being my guest on Spotlight, and certainly the special edition was worth it. I really appreciate it. Thank you for...
Thanks for the invite.
Yes. Great. Yes. I've been having a discussion, a tremendous discussion, with Patrick Gladberry, the Director of Social Marketing Center in the United Kingdom. He's here in the BVI to read it off my paper, to conceptualize a long-term social marketing and behavior change program for non-communicable disease prevention, for a disease prevention strategy, to build capacity in selected staff and social marketing, and to assist with a proposal for funding for the projects. So conceptualize a long-term social marketing and behavior change program for non-communicable disease prevention strategy, to build capacity in selected staff in social marketing, and to assist with a proposal for funding the projects. So he's got 3 very important functions, and this is a big event, a really big endeavor that the government of the Virgin Islands is undertaking to reduce the growth rate of non-communicable diseases and to establish a behavior of wellness maintenance, particularly in regards to the relationship between the healthcare and the National Health Insurance Scheme. So this is a really big event. Thank you for watching. Thank you for your continued words of encouragement, your suggestions, your criticisms. Continue to email me at jtvspotlight@yahoo.com. Don't forget, Spotlight is rebroadcast every Sunday at 2:30 p.m. And of course, you can go to the website, jtvlive.net, and get Spotlight on demand, anything that you miss. And you could also make your comments. Those of you who wanted to comment and didn't want to call or didn't want to text, you can make your comments online as well and let us know what your thoughts are about this new development in the BVI. And I'm sure that you will be seeing this program again, this interview again. So you start paying attention. Some big things are going to be happening. I'm Ed Jurenka, reminding you that when the spotlight is on, you see the facts. Peace and blessings.
This program is sponsored by the law firm of J.S. Archibald & Co. and by the trust company J.S. Archibald Trust Services Limited, both of Roadtown, Tortola, BVI.